Hey everyone, this lesson is on what foods and beverages you should eat and what foods and beverages you should not eat if you have hemorrhoids. Now, we're not going to get into specific details and pathophysiology of what hemorrhoids are in this lesson. If you want more information, please check out my lesson on that topic. But this lesson is entirely on the best foods and beverages to eat and the foods and beverages you should avoid to help improve symptoms and complications of hemorrhoids and help reduce your risk of getting hemorrhoids in the first place. So the first foods, or the first category of foods I want to talk to you about here, include foods that contain high fiber. And the evidence demonstrating that high fiber is beneficial with hemorrhoids comes from this review article entitled Fiber for the Treatment of Hemorrhoids Complications, a Systematic Review and Meta-Analysis. So the reason why high fiber diets or foods with high fiber are important if you have hemorrhoids is because increased fiber consumption has been demonstrated to reduce symptoms and complications involving hemorrhoids. So this can reduce symptoms of internal and external hemorrhoids. And the goal you want here for high fiber intake is at least 30 grams of fiber per day. Now, you might see some sources saying 25 to 35, so at least 25 grams, but I'll say here at least 30 grams of fiber per day. Now, what are some good sources of fiber? So some good sources or good foods that have a lot of fiber in them include nuts like almonds. You can get high fiber from beans, lentils, peas, whole grain foods, vegetables like broccoli, and fruit as well. So again, high fiber intake is important, and really the reason is because it can help reduce the chances of constipation, which lead to development of hemorrhoids and worsening symptoms and complications of hemorrhoids. Now, something else you want to do if you do have hemorrhoids is you want to increase your water consumption. And the reason you want to do this is because the water acts along with the increased fiber consumption. It helps reduce the chances of constipation, which increases your risk of developing hemorrhoids and reduces your risk of symptoms and complications of hemorrhoids. And along with preventing or reducing the chances of constipation, water consumption aids in gastric motility as well. So again, foods containing high fiber, very important. If you have hemorrhoids, you want to aim for at least 30 grams of fiber per day because it reduces the risk of developing hemorrhoids in the first place and reduces the risk of symptoms and complications involving hemorrhoids. And we can find high fiber in nuts, beans, lentils, peas, whole grain foods like whole wheat bread, vegetables like broccoli, and fruit. And then you want to have increased water consumption along with the fiber intake because it acts along with the fiber and it helps aid in gastric motility and prevention of constipation. So those are the two important categories of foods and beverages you want to consume if you have hemorrhoids because it helps reduce the chances of getting hemorrhoids and reduces the symptoms of hemorrhoids. But if you have hemorrhoids, the next several foods and beverages we're going to talk about are things you want to avoid because they can worsen symptoms of hemorrhoids. So one of the first categories of beverages you want to avoid if you have hemorrhoids includes alcohol. And the evidence for this comes from the article entitled Etiology of Thrombosed External Hemorrhoids. So alcohol consumption has been found to be positively associated with an increased likelihood of internal hemorrhoids and thrombosed external hemorrhoids. So as you increase your consumption of alcohol, the likelihood or the risk of developing internal hemorrhoids and having thrombosed external hemorrhoids increases as well. So it increases with the amount of alcohol you consume. So it's best to limit or avoid alcohol consumption in general, especially if you have hemorrhoids. Now, another category of beverages you want to avoid if you have hemorrhoids includes caffeine. The reason you want to avoid caffeine is because caffeine may act as a digestive stimulant. And because caffeine may act as a digestive stimulant, it can increase frequency of bowel movements. So what that does, if you have increased frequency of bowel movements, it can reduce the time between each bowel movement, reducing the time for adequate healing of hemorrhoids. So each bowel movement can irritate hemorrhoids, and if you have increasing frequency of bowel movements, it can lead to increased irritation of hemorrhoids, and you get this reduced time for adequate healing of hemorrhoids. So it's important to limit and reduce or avoid caffeine consumption if you want to improve your symptoms of hemorrhoids as well. So again, if you have hemorrhoids, it's best to limit or avoid alcohol consumption because alcohol consumption is positively associated with increased likelihood of internal hemorrhoids and thrombosed external hemorrhoids. And you want to try to avoid or limit your intake of caffeine because caffeine can cause digestive stimulation, increasing frequency of bowel movements, and increasing irritation of hemorrhoids, preventing them from being healed adequately. The next category of foods you want to avoid if you have hemorrhoids include low fiber foods. Now, we talked about high fiber foods being important for reducing symptoms and complications of hemorrhoids. So, you want to increase your intake of high fiber foods, but you want to reduce your intake of low fiber foods. As low fiber intake increases constipation, increases risk of constipation. And as we mentioned before, constipation itself can actually increase the risk of developing hemorrhoids in the first place and increase symptoms and complications of hemorrhoids. So you don't want to have issues with constipation. So you want to avoid low fiber foods. So what are some foods that have low fiber content? These include white breads and pastries, meats and eggs, and dairy products. So again, if you have hemorrhoids, you want to avoid low fiber foods because low fiber intake can increase constipation, and constipation itself can actually increase the risk of developing hemorrhoids in the first place, and then also worsen symptoms and complications of hemorrhoids. And foods that have low fiber content include white breads and pastries, so things that are not whole grain, meats in general, along with eggs, and dairy products like yogurt and cheese. Now, there's also this question as to whether individuals with hemorrhoids should avoid red chili peppers and spicy foods. And the following evidence actually comes from this randomized controlled trial entitled Red Hot Chili Pepper and Hemorrhoids, the Explosion of a Myth, results of a prospective randomized placebo-controlled crossover trial. So it was once believed that red chili peppers cause or exacerbate symptoms of hemorrhoidal disease, but that randomized controlled trial that I just mentioned actually didn't find any evidence of worsening of symptoms of hemorrhoids with consumption of red chili peppers or spicy foods based on red chili pepper. But I want to mention a caveat here, as spicy foods may worsen hemorrhoids simply due to the fact that they may cause increased diarrhea or bowel movements. And as I mentioned before, that increased frequency of bowel movements may cause irritation of those hemorrhoids or reduced time for healing of hemorrhoids. So in individuals where spicy foods cause a lot of increased bowel upset or bowel movements, it's probably best to avoid spicy foods. But in individuals where this doesn't happen, it's likely not an issue, as was found in that randomized control trial. So again, at one point it was believed that red chili peppers and spicy foods based on red chili peppers could worsen or cause hemorrhoids, but that randomized control trial I mentioned before doesn't show evidence of that. So it appears that red chili pepper consumption is fine, and thus it causes a lot of increased bowel movements where it might irritate the hemorrhoids. So if you want to learn about foods and beverages to avoid if you have irritable bowel syndrome, please check out my lesson on that topic. And if you haven't already, please consider liking, subscribing, and clicking the notification bell to help support the channel and stay up to date on future lessons. Thanks so much for watching, and I hope to see you next time.